until recently, high-risk multiple myeloma patient represented sort of an unmet medical need. And here we're talking about the so-called ultra-high-risk patient, for instance, those patients with two high-risk cytogenetics features, especially when it comes to deletion 17p, but also abnormalities for chromosome 1, PQ, 1p, 1q, but also ultra high risk is about extramedullary disease, it's about plasma cell leukemia. The good news now is that we do have specific trials trying to tackle and to treat these patients. So this is really very important because until recently, they were treated like, I would say, Mr. Every myeloma. And now we have some specific combinations and treatments. And what I could notice, and we had several presentations during this COMy 2022 meeting, is that the use of anti-CD38 antibody combined with second-generation proteasome inhibitors like carfilzomib plus imide like lenalidomide and dexamethasone is really proving to be very effective, especially if these patients are transplant eligible and are receiving consolidation and maintenance. So I think now we have in hand, thanks to these quadruplet combinations based on the anti-CD38 antibodies, the second-generation proteasome inhibitors, the IMiDs, the transplant, consolidation, maintenance, especially doublet maintenance, because there is a proof of concept, for instance, that doublet maintenance with a proteasome inhibitor and an IMiD is really useful in these patients. And this is really promising because we see progressively, especially if these patients are able to achieve sustained MRD negativity, we can see that their outcomes or survival is clearly improving.